body undergoes enormous changes during a pregnancy, and some of those changes are to be expected, and some of those changes might be misunderstood. If a cancer is causing a problem, it's very easy to understand that the patient might initially think that they were changes associated with the pregnancy, and that why their healthcare workers might think the same. Cancer and pregnancy don't occur together very often, so it's not going to be at the top of someone's differential diagnosis. It's not going to be at the top of someone's hit list in thinking what's going wrong with that patient.
Is it high enough up though? Because when a woman is pregnant, she is being scanned more regularly, she's being checked more regularly, medically, than any other time in her life. How does this get missed at that point?
I think it's difficult to miss eventually, but it's not difficult to miss early. So you have to be dogged, you have to remain focused. Have we explained this problem adequately? And if we haven't, seek an answer. The work we've been doing with Mummy Star today has been educating midwives to be alert to the issue of cancer and pregnancy so that they start to think about it, because they may previously not have done so.
If the diagnosis is made though in pregnancy, a woman is obviously going to be very, very worried about what effect any treatment would have on her unborn baby. What would the options be?
Clearly devastating diagnosis. But what we want to reassure those patients is that the majority of options are actually still open to them. And we would want to reassure those patients that most of the time the outcomes from the cancer treatment would be the same as if they weren't pregnant. The terrible experiences in the 1960s have left a scar through an emotional scar that runs deep both for the general public and for medical professions. Everyone's very worried and averse about drug taking. Because we've been forced to have to give these drugs in difficult situations, we do have good data and good follow-up which shows us that actually it's safe. And when you defer the use of chemotherapy into the second and third trimesters, so after the first 16 weeks of pregnancy, after those first 16 weeks, chemotherapy is actually extremely safe. And some of the experts on cancer and pregnancy that we work with have made the claim that alcohol is more dangerous to the unborn child than chemotherapy at that stage.
So what signs should a pregnant woman be looking out for? You say it's rare, but what should they be aware of?
Well, although it's not common, the most common cancer in pregnancy is breast cancer. And the advice for looking for breast cancer is the same for every woman. You're looking for changes in the breast, changes in one breast alone. A hard lump should always be investigated, because a hard lump is not a normal feature of breast development during pregnancy. And the midwives are expert in breast developmental changes and would advise and reassure and check out.
Doctor, thank you very much.
You're very welcome.